This meeting is now being recorded.
Good morning, everyone. This is Tia Whitaker from the Pennsylvania Association of Community Health Centers, and we are pleased today to have a webinar sponsored by the Pennsylvania Health Law Project on immigrant coverage options, and our presenter will be Kyle Fisher, who's a staff attorney. Kyle, you'll need to press star 6 to unmute your line.
Okay, very good. Can you hear me, Tia?
I surely can.
Okay, well, thank you, Tia, and thanks to PAC for facilitating this webinar. I think most of you on the call hopefully have been able to participate in the last couple of webinars we did, and I know the recordings from the first 2 webinars are now posted on the PAC website, so if you missed those, you can catch up there. This is the 3rd webinar that we're doing in a series of 4, so we have one more scheduled. Our last webinar is going to be on working with your local county assistance office and resolving Medicaid appeals, and that's going to be on December 15th, about a month from now. Thanks, everyone, for joining us this morning. Today's webinar is scheduled to go about an hour, and we're going to cover immigrant coverage options, mainly through Medicaid and then also on the healthcare.gov marketplace. As Tia said, my name is Kyle Fisher. I'm a staff attorney with the Pennsylvania Health Law Project. Here are the topics we're going to cover this morning. Before we sort of walk through that, hopefully some of these concepts are familiar to you. I think many of you were probably able to attend the PAC's annual conference last month, so some of this is going to be familiar, and I think that's a good thing. We'll have a little more time this morning to go through these slowly and work through some examples, which in my experience is really the best way to learn these ideas. As with the last webinars, I certainly would like you to pipe in to ask questions or to unmute yourselves, and to do that you would need to hit star 6 on your phone to unmute yourselves, or to use the question and answer, the chat box that's on through the roll call through this webinar software. So please do feel free to ask questions as we go here. If something is unclear, to let me know. If you feel like I've omitted something that's relevant, please do comment in, and I think these trainings really work best to the extent they're interactive. All right. So Medicaid Basics, and I hope you guys recognize these 4 overarching criteria by now. We've talked about them in all 3 of the webinars, and today's focus is really on the 4th prong there, immigration status. It's important to note, though, even though we're only talking about immigration status, the top 3 prongs still apply. And I think this is a common mistake, especially when folks are dealing with emergency medical assistance, and there's a lot of focus on meeting the emergency medical condition prong and proving that. Sometimes people forget that the applicant still needs to fall into a category, and they still need to meet the income limits for that category. So the immigration status criteria that we're going to talk about today is not its own Medicaid category. Okay, so it's just one of the 4 overarching criteria. So typically the folks you're working with, I think most commonly, are going to fall in the expansion for the new adult category, which has, as you know, the 138% of poverty income limit, but not always. So as we talked about before, the category and the income piece are the starting spot, really, for your Medicaid eligibility analysis, and then immigration status is just another layer when you're dealing with immigrants. Okay, here's a cheat sheet of sorts. So this is an overview of what we're going to spend probably half of this morning's webinar talking about. Medicaid has 2 immigration status standards, and you see them listed out here: lawfully present and qualified. Lawfully present is the same standard as is used on the marketplace. In the Medicaid realm, on the Medicaid side, lawfully present is the immigration status standard for children and pregnant women, and only children and pregnant women. For everyone else, which is most adults, the vast majority of the adults you're going to be working with, the standard is qualified. That's a legal term of art that comes in on the public benefit side that we'll unpack, but qualified alien, and then for most adults, they're also going to need to have been in qualified status for 5 years before they're eligible for Medicaid. So that's often referred to as the 5-year bar, and we'll spend some time talking about that one as well. All right, so having given you sort of the answers to start, let's unpack this a bit. As we talked about, the Medicaid analysis, when you're working with patients, it doesn't change for immigrants, except that you have this added layer, so this 4th step, and we'll talk again about how to do, and that's what today's webinar is on, how to walk through the immigration status prong of the analysis, but you'll still need to go through category, household size, and whether they're under the relevant income limit. Okay, we're going to start here with qualified immigrants, which is going to be the main analysis for most of the adults you see who are looking to apply for Medicaid. Qualified alien is a legal term of art that came into being in the late 90s under federal law. And again, it's not an immigration term, it's a public benefit term. And it's so conceptually, it's much more narrow than lawfully present. And it's going to be the status you use for all adults unless they're pregnant, in which case you're going to go back to that lawfully present standard. The 5-year waiting period, we'll talk about when it applies here. It begins running when a person is in the country and in qualified status. And you'll see here, when you're working with CAOs, you want to refer back to their handbook, to the manual caseworkers are using, which is the Medical Assistance Eligibility Manual. And everything, most of what we're talking about today is in the handbook at Chapter 322 and then Appendix A. Very useful. So who is a qualified immigrant? Here's the list, and this is from a Center on Budget and Policy Priorities chart. They're beyond the Basics series, and it's an exclusive list. So this is it, really, right? So it's not that there are other categories out there. Let me give you a quick disclaimer here. I'm not an immigration attorney, so I can't give you much detail on what exactly a conditional entrant is, for example, or I can't tell you what it means to have deportation, granted withholding of deportation or removal. I can't explain some of that. I mean, I would have to look into it the same as you would, but I can tell you that these are the statuses that equal qualified immigrant for purposes of Medicaid eligibility. The one you're going to see the most, the one at least that we see the most by far, are folks who have green cards, legal permanent resident status, or LPR status. That's by far the most common. Analytically, so if you try and break this out sort of conceptually, who falls into this prong, and I will say that you want to be a little careful using sort of these shorthand or just understanding it by framework. I mean, I almost always look back to these lists to verify when I have a client where immigration status is at issue. But as a framework matter, qualified means known to the government and here indefinitely or here long term. And we'll contrast that when we look at lawfully present, which can include folks who are known to the government here for a short period of time, like a worker visa or a student visa. Those short-term time periods, they don't fit into this qualified framework. Let me pause for a second. I'm going somewhat quickly. Any questions here before we start talking about the 5-year bar? And again, folks can use the Q&A function in the software, or you can do *6 to unmute yourself, or the public chat. Although, honestly, I don't think anyone's used it. I'm not quite sure how it works. Okay. 5-year bar. This is not exclusive to Medicaid. This comes up in the food stamp context. It comes up in the Medicare context. Not exactly sure how it works on those sides, but for purposes of Medicaid, 5-year bar applies to Medicaid categories that have federal funding. And it's the waiting period that runs from the date a person gains their qualified status. It's the default, but it doesn't apply to all add-ons. And so here you'll see the exceptions to the rule. So in general, a person needs to have gained the qualified status through becoming, say, a green card holder, and they need to have been in that qualified status for 5 years before they'd be eligible for Medicaid. That's not the case for the folks you see listed at the bottom here. It's not the case for refugees and asylees. So as soon as Cuban or Haitian entrants, or U.S. veterans or active duty military, or their spouses or children. A number of exceptions. Again, I would not expect to sort of memorize these, to know these off the top of your head. Just remember that exceptions exist, and when you walk through the analysis, look back to either these slides or look back to the handbook to see, does the person I'm working with fall into an exception for the 5-year bar? Questions about this before we keep going? All right, we do have a question here. Visitor status, is it qualified or short-term and unqualified? Someone on a visitor visa, it's a short-term time period, right? So in terms of the conceptual framework, qualified status is long-term, so they do not. If we go back here, you'll see that actually no non-immigrant visas are listed, sort of worker visas, tourist visas, student visas. They don't fall under this qualified rubric. So they will come up under the lawfully present prong that we'll talk about next, but for most adults, they have to meet this qualified prong, and a visitor would not. So they would not be qualified for purposes of Medicaid eligibility. Good question. Any others? Okay. So an example here. We have a husband and wife. The husband has been in the United States with a green card and LPR status as an asylee since 2008. Petition for a green card for his wife who entered the country in 2011. And let's say for purposes of the example that he petitioned successfully. So they both have a green card. Their income is 120% of the poverty level, $19,000 a year. Does either meet the relevant Medicaid immigration standard? So working through this, and it looks like we're working with a PDF here, so we already have the chart listed. The starting point is to ask yourself, what's the relevant immigration status under Medicaid? Because remember that it's going to vary. For most adults, it's going to be qualified, but for pregnant women and kids, it's not. So here we're looking at 2 adults under what the information we have, neither is pregnant, but we know we're looking to whether they're qualified. So that's the starting point. They both have green cards, so we can say yes, they're both qualified. Second piece is, are they subject to the 5-year bar? Right? And that goes back to the list of exceptions that we looked at. So in general, they are, unless they meet one of those exceptions. If we looked back, we know refugees and asylees, which was the basis for Gary's green card here, are not subject to the 5-year bar. So even though he has a green card now, and the general rule for green card holders is that 5-year bar applies, if the basis of his green card is one of those exempt conditions or statuses, then he's not subject to the 5-year bar. All right? So you see this sometimes for refugees and asylees. So he's not subject even though he has been in the country 5 years, so it's a bit of a moot point, right? So from an immigration status standpoint, Gary is Medicaid eligible. Looking to his wife, is she subject to the 5-year bar? And here, the basis for her green card is different than her husband's, right? Under this hypo, she has legal permanent residency on the basis of having a relative petition, a husband petition for her. So she's subject to the 5-year bar. And because she entered in 2011, she has not yet satisfied that 5-year bar, right? So for her, even though the husband is Medicaid eligible, she's not, right? So there's no way around that bar until we start talking about emergency medical assistance, which we'll cover later in this training. But for ongoing coverage through Medicaid, not an option for her. But because she doesn't qualify for Medicaid because of her immigration status, then subsidies on the marketplace will be an option, even though she's under the normal income limit to get those subsidies. Hold that thought for now, because we're going to come back to it later in the training. But I didn't want to give you this hypothetical and leave you with the thought that there are no coverage options for her, because there is. It's just one that we want to get to in time. Any questions about this example before we keep moving? Hopefully it's clear to everyone. I think this is going to be the most common example, or the most common scenario you see. Adults who come in who need to meet the qualified status, and then you need to, and typically who also need to meet the 5-year bar. Right? There are exceptions to that, but I think this is the most common scenario. Okay, general assistance-related medical assistance. For those very low-income immigrants who are qualified and subject to the bar but don't meet it, this option exists. And GA-related MA is a state-funded category that the state essentially did away with. It ended this program at the beginning of 2015, except for these immigrants. So once we expanded Medicaid, the state said, hey, wait a second, we have been paying full freight for this coverage group. Let's shift those folks into expanded Medicaid and have the feds pay for them. And that's what it did for roughly 80,000 folks. But for this 4,000 immigrants or so who don't qualify for expanded Medicaid, because they're in the 5-year bar, they couldn't move them over and have the feds pay for them. So they've kept this coverage category, this GA-related MA in place, and they were threatened with a lawsuit to do so, but the states kept this coverage category in place, and so it still exists for very low-income immigrants, and we'll talk about what the income and asset guidelines are. The piece what you want to remember here, and this is likely going to require a little extra advocacy at the CAO level since the program is otherwise been ended. A lot of caseworkers may get this wrong. But the piece to keep in mind here is, again, for those qualified immigrants, so if we go back, sort of like conceptually, Nadia here, Gary's wife, fits into this, right? So she's qualified, subject to the 5-year bar, and she hasn't met it. So she's still in her 5-year waiting period. So GA-related MA would be an option for her if she meets the categorical requirements and if she meets the income and asset requirements. So let's move on to those. So there are 2 ways in to GA-related MA, and this gives you some appreciation for how much Medicaid expansion has simplified doing Medicaid in Pennsylvania. So prior to expansion, and we've talked about some of the other categories that exist, like Healthy Horizons and MAUD, but GA-related medical was one of the more complicated ones, and you can see that here. So a couple of different ways to qualify. First, they can qualify based on age, the bottom piece here, if they're 59 or older, or they can qualify based on disability or need for prescriptions. And that goes back to those of you who have been working in health centers for some time. You know the employability assessment form, and you know the health sustaining medications form, both 2-page forms that a clinician needs to complete. If somebody is under 59, they can be looked at in this category if they have one of those forms completed. And for the employability form, it can't say employable. It has to say that their health condition prevents them from working for some period of time. If they get in on the basis of disability, you see the income limit is about $200 a month for a household of 1, a little over $300 a month for a household of 2, and they're very meager resource limits. If they get in on the basis of age, the income limit is a bit higher. They look at it as 6 months. 6 months at a time, and it's roughly the equivalent of $425 a month, but a slightly higher resource limit. You see $2,400 for a household of 1, for a couple it's a little over $3,000. Don't bother memorizing or trying to memorize these limits. Just remember that this category exists for those clients you have who are subject to the 5-year bar. A couple of questions here. Yeah, refugees and food stamps. Yeah, I can't speak to the food stamp eligibility for refugees, but for so we have a comment that someone's having problems with the audio. Slides are moving with no sound. That may be subject to the way you've called in. You can ask roll call to call your phone, or you might want to hang up and call back in. If others are having problems with audio as well, please let me know by using the Q&A function. All right, so GA-related MA. You see the income and the asset limits are going to depend on how the person qualifies categorically. If we go back to the last example we have, so we had the wife, Nadia, who is within 5 years. she would then need to either present a health sustaining meds form or be over age 65. Even if she did either of those things to be categorically eligible, she's not meeting these income limits, right? So under our example, that couple had an income of $19,000 a year, which is far above these income limits. So she's going to be over income for either of these categories. All right, let's do another example here. Take a second to read through that one. So we have an adult who's seeking insurance for her elderly parents who have green cards recently arrived from India. Mom has Parkinson's. Dad has weakness in his legs, mobility issues. They have no income, but they do have some savings. They're supported by their adult children. What are their coverage options? This is a somewhat common example. We get this at the Health Law Project not infrequently, where we have an adult child who's looking for coverage for their elderly parents who typically have recently come into the country. So they're not qualifying for Medicare despite their age. Do they qualify for Medicaid? So we know the starting point here is what's the relevant standard? Qualified. Clearly the elderly parents, neither of them is pregnant. So we're looking at qualified, and then are they subject to the 5-year bar? Almost always yes, right? Because the basis of their green cards is almost always their citizen children or their LPR status adult children. And then if they've recently arrived, they don't meet that 5-year waiting period, right? So they haven't satisfied the bar, which puts them in GA-related medical assistance territory. So here we're looking, if we go back to how do they qualify, there's 2 ways. And these parents could potentially qualify under either of these GA categories, right? But rather than jumping through the hoops of getting a clinician to fill out a form, it's much easier to just start with the age side, right? So they're both over 59, so we know categorically they qualify. And then you look at the income and the asset limits. Household of 2, the income limit is $2,600 over 6 months. The resource limit is $3,200. So GA-related MA is a good option for this family if they're able to reduce their savings, right? And that's where you see here, under this example, under this hypo, we say they have $5,000 in savings. They would have to reduce that to under $3,200 before they qualify for the GA-related MA. They have no income, so that's not an issue. They would, of course, need a support letter from Mina and or her husband saying we support, we allow them to live here without paying rent, we provide them with food, etc. Right? And we know in Pennsylvania, not all states do this, but for applicants who say they have no income, caseworkers typically want them to document that in some fashion. Most frequently, that's by either getting a support letter from the friend or the family member who's helping them, or if you can't do that, sometimes you have a client who's living off savings and they just write that in a letter, or if they submitting a letter helps. So giving a caseworker a piece of paper on which to back up their eligibility decision typically goes a long way. So Mina would need to write that support letter for her parents. They would need to reduce their savings, and then GA-related MA is an option. I should note that Mina and if she has a husband or a spouse likely sponsored these parents to come into the country, but her income as a sponsor would not be looked at. So they would only be looking at the elderly parents' income that they have themselves. Healthcare.gov, the marketplace coverage and subsidies is another option for this couple, right? So even though they potentially qualify for medical assistance in that state-funded category, it's not considered Medicaid. So they could go to the marketplace side and say, I don't qualify for Medicaid because of my immigration status. And we'll come back to this sort of special rule on the marketplace, so hold that one for now as well, but note that it also exists. It's a scenario where the couple has a couple of different options. We have some questions here. Sorry about that. Older adults here on a visitor status who have diabetes and no income. would they be eligible in this GA-related category where their children are supporting them? So it would go back, they would still need to meet that qualified prong first, right? So the hypothetical, the question here is older adults here who have health problems supported by their parents, supported by their adult children, could they qualify because the 5-year bar does not apply? If they were in qualified status, yes. So remember, for GA-related medical, the only test is the qualified piece, and if they're on a visitor status, they don't meet it. All right, so it's not going to be an option for them. Next question. Parents have no income but the child supports. How do they enter income information on healthcare.gov? So if they're applying on healthcare.gov and they have no income but the support of their children, remember, for marketplace coverage and subsidies, the income test is tied to the tax rules, so it's what taxable income they have. You could look to the tax rules as to whether sporadic cash support counts, but support in the form of allowing parents to live with them without paying any rent, giving them food, etc., fairly certain is not at all taxable and would not need to be entered at all. So a lot of times, healthcare.gov, I think you're going to be listing no, a 0 for income. But if they're applying, if that family wants to apply for GA-related MA, rather than the marketplace coverage, then I would not advise you to apply through the marketplace. I would have you apply through Compass or apply by phone through a state portal, because that's going to be the most direct way to get them coverage. The marketplace is not going to be able to screen for GA-related MA. Since it's not a federally funded category, the marketplace can't compute. Okay, moving to the second standard. So remember the cheat sheet I gave you at the outset. We have 2 relevant immigration status standards. We're looking at qualified and we're looking at lawfully present. So this one's going to go a lot faster because it's much more straightforward. Lawfully present, again, a legal term of art. This is the standard for pregnant women and children in Medicaid. In 2012, Pennsylvania adopted this option. It was created under federal CHIP law, surprisingly enough. Okay. Obviously, hopefully, you guys all know the lawfully standard is the status or the immigration status standard on the marketplace, and it's the standard for everyone on the marketplace. There's no distinction between adults and children. With Medicaid, there is, and it's for kids under 21. On either side, DACA status, deferred action childhood arrivals, are not considered lawfully present. Lawfully present does not include the DACA or the Dreamer status. If you want to look on the marketplace at who else it does include, then we'll go through a list here. You can see that on the link that's included. The basic framework, though, is that the person is known to the U.S. government and permitted to be here. And it doesn't matter whether it's short-term or long-term, with the exception, again, of DACA. So the big category, the big group of folks that this covers, who are not ever included in the qualified prong, are folks who are on short-term visas, non-immigrant visas. So worker visas and student visas are the ones we see a lot. Lawfully present includes all the qualified immigrants, but note that's a one-way ratchet. It doesn't go the other way around. So lots of folks who are lawfully present are not qualified. But everyone who's qualified, so refugees, asylees, green card holders, they are all also lawfully present. It's a much broader category, if I can put it that way. It's another chart from Center on Budget and Policy Priorities, and it keeps going. So you'll see applicants even for a green card status, as long as they have sort of an accepted application, that's enough to make them qualified. Applicants for asylum, victims of trafficking visas, etc. You can see certain categories here require that they've been granted employment authorization, and you can see what those are on the right-hand column. Again, I'm not an immigration attorney. I can't give you a lot of detail on what some of these terms mean, but here is the list that I would use, and I do use, when we have immigrants come in with a status that I'm not certain of. Note that qualified does not equal Social Security number, right? And that's unfortunately sometimes we have caseworkers who do this. We certainly see it a lot on the CHIP side. And you'll see it on applications. What's the Social Security number? Does the family have Social Security for the child, or do the parents have it? That's not the relevant test. Okay, and we'll talk a little more about when you need to put that in an application. But Social Security number does not equal qualified. Right? So typically, if you have somebody who has a social, they are going to be qualified, but not always. Like going back to the DACA status, Deferred Action Childhood Arrivals, so folks who came here as children and they now have this sort of quasi-status, they can have Social Security numbers, but that doesn't mean they're qualified for purposes of health coverage eligibility. No questions? Any questions on this? Talk about marketplace coverage for immigrants not eligible for Medicaid. So we touched on this for a couple of the hypos we've had already. There's a special rule in the marketplace for immigrants who don't qualify for Medicaid because of their immigration status. So we know the healthcare.gov, the immigration status requirement is lawfully present, right? Normally, to get subsidies on the marketplace, a person has to be above a certain income floor, right? There's an income floor and there's an income ceiling. Normally, and we saw this a lot in 2014 for folks in the coverage gap, they were too poor to get APTCs, to get those tax credits to help afford coverage on the marketplace if they were under 100% of poverty. Now that Pennsylvania has expanded Medicaid, that income floor is generally 138%. Right? You guys know this. If somebody applies on healthcare.gov, their income is under 138%. Normally, they're going to be booted to Medicaid. Right? You're under the income floor. But for somebody who doesn't qualify for Medicaid because of their status, there is no income floor. So it doesn't matter, for instance, that Mina's parents have no income, right, in that example that we had. Because they don't qualify for Medicaid because they're subject to that 5-year bar, they can get the full amount of premium tax credits and cost-sharing reductions with marketplace coverage. Now, as a practical matter, I think you might have to produce the Medicaid denial. But keep in mind, this is a very important category for those immigrants who don't qualify for Medicaid. And this is just a visual representation of the same thing here. Hopefully some of you have seen this slide before. Looking at the second and third columns here, then this is folks, the Medicaid expansion, essentially who's covered by that red dotted line box. You see we had a cutoff on subsidies, premium tax credits, cost sharing reductions at 100% of poverty. That's now, like I said, up to 138 because the framers of the Affordable Care Act never intended the exchange and subsidies to cover very low-income folks. It was always intended for folks who were over-income for Medicaid. But for immigrants, because the immigration status standards are different between the two programs, they created or they allowed subsidies to be available to them even though they're under that income floor. Oh, we have a question here. When applying for an example, family size, we can enter 0 income and answer the question. Excuse me. Denied for Medicaid due to immigration status, father and mother will get medical insurance through healthcare.gov. Right. That's right. So going back to the Mina example, she's applying for her elderly parents. They would be denied because of their immigration status, and then they could get insurance through healthcare.gov. I'm not certain that they would have to produce that denial. I'd have to rely on those of you who've done some of these marketplace applications for immigrants to let me know how much the marketplace is requiring. Okay, we have another question, again about visitors' visas. So visitor status. Could they get marketplace coverage? So that goes back to the chart we saw of who's lawfully present. And non-immigrant visas, like worker visas, student visas, tourists, Again, those visitor status, they're known to the federal government here short-term. Yes, they are lawfully present. Lawfully present only works on the Medicaid side for children and pregnant women. But on the marketplace side, it's the only standard, so it works for everyone. So they could get coverage to the marketplace, and it doesn't matter that they're not qualified. The qualified prong is only on the Medicaid side of the fence. I hope that answers the question. All right. Yep. Healthcare.gov. So mainly, who does this affect? A special rule for folks who are under the normal 138% income floor. It's going to catch those qualified immigrants, like me and his parents, who don't meet the 5-year bar, or also like Nadia in our first example, right? So she was here. In the first example, she was not pregnant, so even though she had a green card, she was qualified, but she was subject to the 5-year bar. She could get coverage with subsidies in the marketplace. It's also going to catch the lawfully present immigrants who aren't qualified at all, right? So looking at, for instance, that person on the H-2 worker visa who may be under the normal limit to get Medicaid in the expansion category, but because of his or her status, they can't, right? So then you're looking at healthcare.gov. So we talked, for those very low-income immigrants, we're looking at, they have a couple of options. Because GA-related MA is not considered Medicaid. It's a state-funded Medicaid look-alike, which means, for all intents and purposes, the coverage is the same. They pay slightly more in premiums, and there's no premium, in copays. So their copays are a bit more. It's still going to be much cheaper than marketplace coverage, but the downside is there are going to be fewer doctors who take it, and that's particularly the case for these low-income immigrants because they're going to be put on fee-for-service. It's the access card. They're not going to be in managed care. But that's the drawback. If they're very low-income, they have the option. They can choose between either the marketplace coverage and subsidies or the GA-related MA. And again, that again goes back to the MENA hypothetical where her low-income parents can go either or. So if they wanted to reduce their savings, they could get the GA MA. If they didn't, they wanted to keep those savings, they could do the marketplace coverage. Of course, if they go the marketplace route, they're going to have premiums, right? Even with the full premium tax credits, it's not going to be premium free the way Medicaid is or GA-related MA is, but that's their option. Next example, we're going to alter the first. So we have Gary and Nadia again. This time we're saying Gary has a green card, but the basis is not as an asylee. The basis is now the lottery, the diversity lottery. And instead of being in the country since 2009, we're saying now he's been in the country since 2011. He's petitioned for a green card for his pregnant wife, Nadia, who lives with him. And again, they have income at 120% of poverty. So how does this change the analysis? We have Gary's qualified, right, because he has the green card. Because he's not an asylee, because he hadn't been an asylee, he's subject to the 5-year bar. And because he's only been here since 2011, he hasn't satisfied it, right? So he's lawfully present. All qualified folks are also lawfully present. And because he's not able to get Medicaid because of the 5-year bar, then he fits this special rule for coverage through the marketplace. Hopefully that's straightforward. That's what we've talked about in the last couple of slides. For Nadia here, we're saying she does not yet have her green card. She just has the petition. So she's not qualified, right? She is, but she is lawfully present. And this goes back to, I think, the third column that we showed on the chart from Center on Budget and Policy Priorities. So she has a relative who has petitioned for a green card for her. And she's here, so she's lawfully present but not qualified. Lawfully present for a pregnant woman is sufficient. There's no 5-year bar when we're looking at lawfully present on the Medicaid side. So she gets Medicaid and he gets marketplace coverage with subsidies. Any questions about this one, how I walk through it? So I apologize for sniffling a bit here. I have a little bit of a cold, but let's see. No questions. Let's press on. Another example. So we have a family of 3, 5-year-old, and her parents who are here on TPS status, temporary protected status, and they have no income. What result? Okay, so hopefully, as you can see there, they're all lawfully present, right? TPS status is a short-term status that falls under the lawfully present criteria, does not make them qualified. So then you're back to what's the status for Medicaid, and that's going to depend on whether they're an adult or a child or a pregnant woman. For the adults, it's not enough. Lawfully present is not enough unless they're pregnant, so we're looking at healthcare.gov coverage. For the 5-year-old, we're looking at Medicaid. Moving to our next section here, emergency medical assistance. So this is a fallback. For your clients who don't qualify for any ongoing coverage, they can get time-limited EMA, emergency medical assistance, if they have this heightened, if they meet this heightened medical standard. So it requires no particular status, and a person applying for EMA does not have to divulge their status or their lack of status. In the SSN, in the field that asks for social or immigration status, you can write not applicable, applying for EMA only. But they do still need to fall into a category. They still have to be categorically eligible, and they have to meet the income requirements for that category. For most of your clients, it's probably going to be the expansion category. You see the definition here. It's a 3-pronged definition. A person only needs to meet one of those 3 prongs, but if the health condition meets more than one, certainly specify that. In applying for Medicaid, they need a doctor's letter, and this is where a person has the highest odds getting this time-limited coverage if they have a doctor. And typically, we can work with an office manager. You can certainly work with the office manager at a health center to draft this letter and to use the exact language you see here, the exact language in the definition of emergency medical condition. Right? So you want to specify patient X has a torn rotator cuff, and without surgery, she is going to have serious impairment to her ability to lift her arm. So serious dysfunction in her arm. Right? I had a client recently who had a torn retina, who was going blind in his left eye. Right? He needed immediate surgery. We worked with the doctor's office as well as eye hospital to get a letter that incorporated this exact definition and specified how he was going blind. He would have serious dysfunction of a body organ without surgery. All right? So it pays to do some front-end work. So if you're fighting over an appeal on the back end, that's less ideal than getting a good doctor's letter on the front end that goes in with the application. EMA can cover labor and delivery, but it doesn't cover prenatal care unless the applicant has a high-risk pregnancy. So a lot of hospitals that that deliver for immigrants, a lot of times they know this and they will help with the EMA application. EMA can also be retroactive, and often is for folks who have gone into an ER, they've had a surgery or something else like that. Hospitals can apply and get the coverage basically to pay that bill. But it's not the case, though, that a person can only get emergency medical assistance if they have a condition that would require emergency care through an ER. Right? So even though there's some similarities in the standard, it's not the same thing. Right? Somebody who needs, for instance, chemotherapy or cancer treatment, they're not going to get that through a hospital ER, but they can get it through EMA. The second prong is an important one. All right, there has to be a specific start and end date. And this is similar with an EAF, where doctors sometimes, the employability form, where doctors are reluctant to say exactly that the condition is going to end on January 31st, but it's just one of the rules we have to deal with, right? So they need to put a specific date in. And keep in mind, the shorter the better in terms of getting it approved. So obviously, not the shorter the better in terms of having coverage for our client, but in terms of getting the state to approve this, asking for 2 months is much more likely to be approved than asking for 9 months or 12 months. So in the examples of my rotator cuff surgery patient and my my client who was going blind, we asked only for 2 months in those cases, and we had success in getting, basically the surgery was the main point. They needed that surgery covered. And then if there's follow-up care that's needed after that, they can submit another EMA application. It's going to depend on whether they meet the standard post-surgery. We have some questions here. Let's look back. So we have a question asking, had a client denied EMA even though he has a serious medical condition? His heart function is only 10%. He was denied because he doesn't have a cancerous condition. How can I fix it? So we can talk more offline, and it's certainly not the case that a person has to have cancer in order to get emergency medical assistance, but they do have to fit into this definition. So somebody with a 10% functioning heart, I would think, the possibility of losing the function of the heart entirely would be enough, but you're probably going to have to work with the person's treating physician and really doing a strong letter that explains what the condition is and how it meets the standard. A lot of times doctors, they're not used to having to incorporate a legal standard like this into their letters. I think it's enough to say, patient X has COPD and a blocked heart and he needs coverage. And it's not. You want to incorporate this legal definition into the letter to get it covered. We have more information on emergency medical on our website, but it's a bit varied. So I'm going to point out here, if you go on to phlp.org and click on the For Providers tab and then look under FAQs and Forms, I'm not sure why it's in this section, but this is where it's at. We have a fair amount of information, including a template letter that doctors can use that has that exact language. And again, that's really, along with asking for a short period of time, using the exact language is the other key to getting these cases approved. We also have a manual, specifically in immigrant health care coverage, on our website, and that was updated earlier this year. So you can get to that through this webpage. You can also go through our resources and publications in general to see more information around what we've been talking about today. Questions on EMA before we keep going? All right, we have a question asking, could this category often be why some patients get to me at the hospital after they had a hospital stay, and they say they've already done an application? Could be, sure. So hospitals are often adept at doing Medicaid applications, and their focus is on getting the hospital stay paid for. The application is not the same as the new adult category under expansion. So I think there's a couple of things to unpack there. Hospitals can do presumptive eligibility. So a hospital can do a screening and turn someone on basically themselves. But turning them on, the person's not getting the access card. They're not getting the ability to go fill prescriptions until they've completed the application that the hospital started. But the hospital's been able to turn on their coverage, for purposes of getting essentially the hospital cost paid for afterwards. So it's like submitting the application on the front end and then starting the process. So it can be the same as getting somebody in the expansion category. For immigrants who would only qualify under EMA, so somebody who is an adult and they're not in the qualified status, then the hospital application is going to be for emergency medical only. So it's going to be a slightly different, it's going to be trying to address and hopefully prove that the person had an emergency medical condition. So at that point, your analysis is going to change. Let's talk about some pointers here, tips. How does Medicaid verify a person's status? They use the SAVE system, so they're confirming with Department of Homeland Security to verify their status. It's only used for benefits eligibility. A common concern for folks who have no status is that they're going to be sort of reported to DHS. That's not the way the system works. And we honestly, I think the legal services community as a whole has not heard of anyone having a problem around applying for Medicaid coverage for themselves or their children and having that information shared or divulged to DHS improperly. It's not an issue we have encountered. Now, despite the ability to do some data matching, the caseworkers do often request documentation. And the type of document is going to depend on the immigration status the person has. Like I said before, they're often asking for a social, even though a social is not required. And there are qualified statuses that don't give a person a social security number, right? So you may need to educate the caseworker on what they have and on the fact that they're qualified despite not having that SSN. The documentation that the workers typically need is in the handbook at Appendix A or B. NILC, the National Immigration Law Center, also has some really good documents. They have a good chart explaining what documentation from an immigration standpoint a person would have with the various status. Mixed households, and this goes back, I think the most common scenario is where you have parents who may be undocumented and they have citizen children. The parents, they have to be on the application for Medicaid, right? They are going to be relevant to household size, and their income is going to be relevant, so they need to divulge their income. But they don't need to put in socials or their immigration status at all. And the Medicaid application is fairly good about saying if you are applying for this person, right? And so for the instance where you have parents with no status applying for their children, they're a non-applicant. So they need to be on the application, but they don't need to list their own socials or lack of socials or immigration status because they're not applying for coverage for themselves. And here's the paper application, the PA 600HC, where you can see, answer the questions below if you are applying for yourself, right? And again, parents applying for a child, they need to be on the application. They need to specify what their income is. And sometimes there's some issue verifying their income if they're paid under the table, but getting a letter from the employer or writing a letter themselves, or maybe with your help saying, parent ABC attempted to get a letter from his employer, but the person was unwilling. I can attest I've seen that they are paid by in cash X amount on Fridays. Some tips, immigration status. So those of you who have worked with immigrants a lot probably already know this, but I think everyone knows it's a very charged issue politically. There's some terms that we try to avoid because it's not conducive to getting people to sign up for coverage for themselves or their children, right? So talking about asking someone, are you legal or illegal, it's not a good idea in terms of their comfort level, right? So you can read through this in terms of tips, but generally you want to talk about what the immigration status requirements are. Explain to them qualified, not qualified. When you use words like eligible or ineligible, you want to avoid asking them if they're not lawfully present or avoid asking them if they're undocumented, right? You want to go about that a little more tactfully. If you're applying for Medicaid or if you're applying for GA-related MA, please don't put the application through healthcare.gov. It's better to go directly through the state. So that's either Compass application online or they can apply by phone. They can apply by mail or in person, but I would suggest online or by phone to start. It's a faster process. And I think hopefully you all know at this point, Medicaid does not have an open enrollment period, so you can apply anytime during the year. Resources. So again, the handbook, and certainly if you're dealing with a caseworker and there are questions around whether your consumer qualifies, you want to point the caseworker towards the relevant section in the handbook. And so you'll see there are a lot of subsections there in Chapter 322. Healthcare.gov has a decent list of who's lawfully present. And if you want to get into details, Center on Budget, the Beyond the Basics series is really good. And NILC, the Immigration Law Center, has some good materials on their website. Our manual, I give you the link to there. And then if you have questions, feel free to email me if in thornier cases. Happy to walk through some of these cases with you. All right, I think that wraps up our webinar this morning. Are there any questions before we end? Doesn't look like it. Okay, so I think Tia will be posting the webinar slides on the website before long, just as she has for the last couple of webinars. If folks have questions that come up once we've stopped today, feel free to be in touch with me, and email is probably the best way to do that. And thanks, everyone, for joining us.
Thank you, Kyle. Thank you, everyone. Have a good afternoon.